Dear veterinarians and veterinary students, today we are going to discuss a very important topic, and that is deworming and common anthelmintics that are used for deworming. First of all, I will give a brief introduction about the common parasites that are present in the veterinary animals, and after that, we will move towards the common signs of parasitism in the animals, and then followed by the common groups of anthelmintic drugs that are used for deworming in veterinary animals. So let's start. First of all, moving towards the brief introduction of parasites, there are two major classes of parasites, ectoparasites and endoparasites. Ectoparasites are present outside the body, like ticks and mites. Endoparasites are present within the body, for example, protozoans and helminths. Our topic of discussion will be concentrated on helminths today. Helminths could be further classified into three major classes: trematodes, cestodes, and nematodes. And if we talk about common examples of these three classes, the common example of trematode is Fasciola hepatica. The common example of cestode is Tinea saginata or Tinea multiceps, and the common example of nematodes is Dirophilaria immitis, which is also known as heartworm in dogs. These are some of the common examples I have enlisted for trematodes, nematodes, and cestodes, and their common names as well. Then, how a parasite basically damages the animal, why it is important to perform deworming. Basically, when a parasite enters the body, it could damage the animal in several ways. It could be by absorbing digested nutrients, it could be by sucking blood. For example, Haemonchus sucks the blood in sheep. It could be mechanical obstruction. For example, strong oils cause mechanical obstruction in cases of equines and cause colic. And it could be a tissue damage. For example, Fasciola hepatica damages the liver in case of cattle. And it could be suppression of immune system, which is caused by most of the parasites. So these are some of the mechanism by which parasites harm the animals. Then what are the common signs of parasitism from which we can guess that either this animal is suffering from parasitism or not? The common signs of parasitism include weight loss because parasites digest or use the nutrients of the animal, and it could be emaciation, it could be diarrhea because of parasites, it could be soil leaking, which is known as pica. Then it could be anemia because most of the parasites sucks the blood and result in anemia. And it could be submandibular edema. As you can see in this picture, this animal is suffering from submandibular edema. This submandibular edema happens when some of the parasites attack the liver and cause hypoalbuminemia. When there is hypoalbuminemia, the oncotic pressure drops, resulting in submandibular edema. And it could be rough. This next sign could be rough hair coat, dullness, depression, and difficult breathing in case of lungworms, because lungworms reside in the lungs and cause difficult breathing. This is a FEMACA chart, which is used to categorize the degrees of anemia because of parasitism in animals. Now coming towards the main topic, that is deworming. That what is deworming? Deworming is basically a procedure which is used to free the animals from worms with the help of some drugs which are known as anthelmintics. There are 8 major groups of anthelmintic drugs. I have enlisted all of the 8 groups. Now one by one, we will discuss the mechanism of each group briefly and then give some examples of each group. The first group is benzimidazoles. Benzimidazoles basically work by inhibiting the polymerization of the tubulin protein. And when there is inhibition of polymerization, the parasite cannot uptake the glucose, and which leads to starvation of parasite and ultimately death of the parasite. The common examples of this group include fenbendazole, mebendazole, albendazole, and oxbendazole. Fenbendazole and mebendazole are pregnancy safe, but rest of the benzimidazoles are not pregnancy safe. They can cause teratogenic effects if given during pregnancy. These are some of the common dose rates of all the benzimidazoles. Then moving towards next group, that is macrocyclic lectons. Macrocyclic lectons basically kills the parasite by causing hyperpolarization by allowing influx of chloride ions. Basically, what they do, they open the glutamate gated channels. When these channels are opened, there is influx of the chloride ions, which results in hyperpolarization, and hyperpolarization ultimately leads to spastic paralysis of the parasite. So this is how they kill the parasite. Then macrocyclic lectons are contraindicated in border collies because they cause nervous signs in this breed of the dog by crossing the blood-brain barrier. So you must be very cautious while using ivermectin or any other macrocyclic lecton in border collies. Then these are some of the common examples of this group: ivermectin, doramectin, moxidectin, and their respective dose rates in different species. Then comes third group, imidazothiazoles. The mode of action of this group is they act as a agonist of nicotine acetylcholine receptors and cause sustained muscle contraction with the help of increased acetylcholine. When there is sustained muscle contraction, it will lead to spastic paralysis and ultimately expulsion of the parasite from the body of animal. So this is how they work. The common example of this group is levamisole, which is considered to be a drug of choice for the lungworms, and the dose rate of this anthelmintic is in front of you. Then comes fourth group, that is tetrahydropyrimidines. They basically inhibit the acetylcholinesterase enzyme of the parasite. And when this enzyme is inhibited, acetylcholine will not be degraded. It will accumulate in the synapse and will cause continuous contractions leading to spastic paralysis of the parasite. And ultimately, the parasite will be expelled out from the body of the animal. The common example is pyrantel pamoate with a dose rate of 25 milligram in the small ruminants, in the large ruminants, and 6.6 milligram in small ruminants and equines. Then comes fifth group, substituted phenols. The mechanism of action for this group is very simple. This group basically inhibits two enzymes in the Krebs cycle. One is succinate dehydrogenase and second one is fumarate reductase. When these two enzymes are inhibited, the parasite will not be able to generate ATPs through oxidative phosphorylation and will suffer death because of ATP depletion. So this is how they cause death of the parasites. The common example is nitroxinil, which is a very effective anthelmintic for the liver flukes in the cattle, and dose rate is 10 to 15 milligram per kg, but through subcutaneous route. Then comes salicylanilides, sixth group. The mode of action for this group is similar to the previous group as of substituted phenols. The common example of this group includes clozental, oxyclosanide, and niclosamide. The dose rates of all these anthelmintics are in front of you. Then comes some miscellaneous anthelmintics. These include praziquantel and piperazine. The mechanism for praziquantel is that it causes increased flux of the calcium leading to spastic paralysis, but piperazine causes flaccid paralysis by blocking the neuromuscular junction. The dose rate for praziquantel is 10 to 15 milligram per kg in ruminants and 1 to 2 milligram per kg in equines. And piperazine has a dose rate of 110 milligram per kg through per oral route in the equines. Then comes the last group of anthelmintics, that is organophosphates. It is used for the ectoparasites as well as endoparasites, just like ivermectin. The mechanism of action for this group is similar to imidazothiazoles, as they inhibit the acetylcholinesterase enzyme. When this enzyme is inhibited, acetylcholine is accumulated, which cause continuous contractions leading to spastic paralysis and ultimately expulsion of the parasite from the body of animal. So these were the 8 groups of anthelmintics. If we go towards the summary of these 8 groups, that which anthelmintic should be used for which category of the parasite. So this is a very brief summary that for trematodes, you can use oxyclosanide, nitroxinil, and triclebendazole. For nematodes, you can use oxfendazole, levamisole, albendazole, fenbendazole, and mebendazole. As far as the cestodes are concerned, the drug of choices for cestodes include piperazine, praziquantel, and niclosamide. So this is all about deworming and anthelmintics that are used for deworming. So here is the summary of all the groups that I have recently explained in front of you. Hope you find this video very helpful. Thank you very much.